I want to get right
Hey,
out
Alex.
to a tweet that you released, which said, if it passes, it will be the single or the greatest policy achievement by a GOP Congress in my lifetime. So why
Yep.
do you say that?
Well, what are the flaws with Obamacare that I and others have been talking about for many years, Alex? One of the biggest is that the program expanded Medicaid, a program with no better health outcomes than being uninsured. It traps people in a program where they don't get access to physicians. Instead, what I and others have talked about is give them access to private insurance, in some ways like what Obamacare tried to do with the exchanges, the ones that Jonathan Gruber helped design. That's what this bill does. It offers the people who were formerly on Obamacare's Medicaid expansion the opportunity to buy private insurance that's heavily subsidized through tax credits. And that way, if their income goes above the poverty line or below the poverty line, they don't have to go up and down from Medicaid to the exchanges and back. They're on one insurance plan with one doctor, one provider network, one group of hospitals and clinics that care for them, and the quality of their care is going to be a lot better as a result.
Okay, but when we get down to the nuts and bolts of this whole thing, I mean, it's an oversimplification for sure here, but is cutting Medicaid basically the whole idea behind the bill?
No. So again, what this bill does is it repeals or phases out the expansion of Medicaid under Obamacare and replaces it with a system of tax credits so that those individuals can buy private insurance just like people on the Obamacare exchanges can, but at lower cost with lower premiums and lower deductibles.
So wait, you're targeting folks that are on Medicaid with tax credits. Like where does the line get drawn there?
Right. So right now, the way it works is Obamacare has the Medicaid expansion, and it has tax credits that you use to buy insurance on the Obamacare exchanges if your income is above 138% of the federal poverty level, or 100 in some cases. So basically what happens now is you're either on Medicaid or you're on those exchanges, and that depends on your income. Under the Republican proposal, you'd have tax credits to buy insurance regardless of whether you're below or above the poverty line. So you'd be in one system that makes the system a lot simpler, more accessible, with better access to physicians and better health outcomes.
Avik, does this guarantee that as many people would have health insurance?
I believe that the number of people that will have health insurance as a result of this bill will be greater than the number of people who have health insurance today. If you look at, for example, Texas, where I live, Texas is a state that didn't expand Medicaid. Now, all the people in the state who would have been eligible for a Medicaid expansion but haven't gotten it because Texas didn't expand Medicaid will now be eligible for these 100% federally funded tax credits to buy health insurance, which is actually a better outcome for them because the tax credits will allow them to get better coverage.
Now, you may
so
be
that's
there.
one of
Okay, but you're in Texas. They may have, it may have dwindled to a degree, but a lot of states have expanded Medicaid coverage.
Absolutely. So in those states, the people who were stuck in Medicaid, where, again, they don't get really good access to physicians because a lot of doctors don't take Medicaid, they'll now have access to a better form of coverage that allows them broader access to physicians than they have today.